Thanks so much for joining us for this week in Jacksonville Business Edition. And today I'm joined by Dr. Kyle Mikals and Dr. Samantha Mikals, both board-certified physicians, both military veterans, and now veteran entrepreneurs building a healthcare practice here in Jacksonville. I'm excited about this for a variety of those reasons I just mentioned there. Recently returned from overseas service, and we're going to talk about leadership, transition from military service to business ownership, and then why healthcare is a key part of this region's economic growth. So thank you so much for saying yes. For each of you, and ladies first, I suppose. Dr. Sammy, you told me I could call you that. What's one leadership habit that maybe you brought from this military service that informs what you do now as an entrepreneur?
So in the military, there's a lot of reinventing the wheel, needing to be creative to get projects completed and get things to happen, especially for patients, especially overseas. And I think that for me, as more of the creative artist, part of our duo is that I'm good at pivoting, thinking on my feet, making up new solutions, innovating, and then making the decision and just going forward.
Yeah, Dr. Kyle, tell me about your experience there and what that brings to this entrepreneurial venture.
So I learned a lot about making policies and procedures in the military. It's a big thing, and especially since we move around from place to place. And so, you know, when you're there for 3 years at a time, I was really good at making policies in terms of how the clinics were operating when I was there. And so that way we had a nice standardized procedure in place. And then, and same when we brought to this, and that way, you know, as we scale, I'm able to, you know, scale from there.
Yeah. So that's, I wanted to get into some meat right away, but tell us about the operation. Tell us about what you guys are doing. Again, it's a new venture here in Jacksonville, but Dr. Sammy, maybe you start. What is the company and the mission and all of that?
Yeah, so we moved here mid-July from Japan and opened Jacksonville Concierge Medicine together. It's literally a mom and pop shop, just the two of us. We don't have any other employees at this time. And we wanted to bring our skills to the population in a way that could be fulfilling for us as well as the patients and clients. So Kyle is an internal medicine doctor by training, so he does concierge direct primary care for adults. And then I'm an ENT, and so originally I was just gonna do home call Botox injections. And then it evolved into private concierge ENT consultations. And now I'm kind of like a mini med spa and concierge ENT for some radio frequency collagen treatments, as well as, heck, weekend suturing, you know, in my studio because somebody contacted me and they had a cut, you know.
So this is really interesting to me. So in order to come up with that entrepreneurial idea, you said, hey, how do we make this win-win-win for us from what you guys were doing? And you can tell me more about your experience there. And you saw there's probably a need in this region we're going to. And Dr. Kyle, I know this is coming back home for you, right?
Yep. Yeah, I haven't lived here in 20 years. And so it's been a long time.
But grew up in the area.
Yeah, I grew up here.
Did you go to a school nearby?
Yep. Yeah, I went to Episcopal for high school.
Yeah. I was going to let you talk about that. Where was school for you, or like a college for you?
I went to University of Florida.
I thought you might want to get that in as well, yes.
Yeah, big Gator fan.
Go Gators.
So yeah, tell me about some of those ideas that you thought, man, this is going to be great for us, and it's going to be great for people in Jacksonville.
Well, because eventually, at the beginning, I was looking for a place, a private practice that was insurance-based originally, and when I looked around, I couldn't find any that wasn't owned by a big health system. All the private practices, every time I'd find one, I was like, oh, no, it's been bought out. And I really, you know, after being in the largest health system, the military health system, I wanted to find something smaller. And so after that, I then started to look more for, you know, something that's smaller that we could control. Some of my friends went into direct primary care, which is, you know, an up-and-coming field, and same with concierge. And so it was nice to be able to just, you know, just be us and not have any employees, and we could just do and take care of our patients.
So maybe help us understand what the differences are there between the concierge and the direct care that you're talking about.
So concierge medicine is typically where you charge an annual fee as well as bill insurance. And then for direct primary care, they don't deal with insurance at all. They just charge a monthly or annual fee, and then they try to do cash-based lab fees, radiology fees, and not use insurance as much.
Yeah. Tell us about the military experience. I know that as I was doing my research on your experiences, so both of you were trained in medicine through the military, right?
Mm-hmm. Yeah, so we met at the Uniformed Services University in Bethesda, Maryland. I was actually originally in the Air Force until I married Kyle and switched to the Navy. You know, we want to stay together.
Yeah.
And so we had a really good training and practicing experience through the military. I really think that being a military medical student, I had a lot more hands-on time than probably my peers around the nation. And then after residency and after residency, I think we were just thrown out there into leadership positions and definitely grew a lot as doctors.
So help me understand that. So how did you get more hands-on? Because the training there, it's like, hey, you just learned about this in class, but let's go treat some patients together?
Well, from year one, we would have simulated labs to do like practice exams, interviews. We would have an anatomy lab where we have to learn all the muscles and blood vessels, nerves, all of that stuff, and dissect it. And I think that in the military system, maybe because of the way it's structured, we as medical students got to scrub in to surgeries and go see the patient first, then report to my resident or attending, who then reports to the attending, and we got to write the note and get it critiqued. And I think that in a lot of civilian normal training environments, that might be not quite accepted by some of the patient population. It might be more sensitive.
Sure.
They might be going somewhere for a famous doctor, so why would they want to see a student first? And so I think that that those kinds of factors were really advantageous.
I'd love to hear more about the experience. How long were you in the military? And I know you said started Air Force, but in the Navy for both of you. And then maybe catch us up to, you were in Japan, and then you said we're coming back to the States. So more of your story, please.
Oh, yes. So I joined in 2010 and then went to the Uniformed Services University for medical school. And then from there, I did internal medicine residency at Walter Reed and then stayed on as staff. And then I worked in the Warrior Clinic. And so I took care of Army wounded warriors. We were still in Afghanistan at the time. And so we had amputees, patients with cancer. And so I took care of them. And then eventually went to Camp Lejeune, where I was a chief hospitalist. And then I was there for 3 years, and then through COVID, which was interesting times. People are getting plucked, left and right to go different missions. And then from there, I went to Japan, where I was the Associate Director of Medical Services. And I oversaw the emergency room, primary care services, non-surgery, subspecialty clinics. And so it was a great time.
So how's my math? So 15 years in the Navy.
Yeah, I was 1 year
Similar?
ahead in medical school, so I have 16.
Okay.
I did my
Not
residency.
holding that over his head over there.
I do all the time.
I've got
Yeah.
more experience than you.
Yes. I did residency in ENT at Walter Reed as well. Between first and second year, I did one general medical officer tour at the Washington Navy Yard in downtown. And some of it, the time was spent at Quantico as well. And then after residency, we were at Camp Lejeune together, and that was my first attending ENT position. And of course, Japan, and I got to be department head for ENT in Japan as well.
So this is, as you know, especially coming back here and some roots in Jacksonville or Northeast Florida, so many people who are serving now or did serve and decided I'm retiring here, so many people in our community are veterans.
Yep.
How important was that to you in terms of deciding we're gonna leave the Navy, we're gonna leave Japan, we're gonna come back to the States, and you decided on Jacksonville? How did that factor in?
Well, I mean, mostly, a lot of it was family. My mom's still here, and so, being in the military, you go from place to place, you just don't have family there to help with the kids and things like that. And so coming back to be able to have that support was great. And then having, already people that you know in the area, it's nice to have that support.
Yeah, we are very fortunate that we have the Deerwood community as well, that we plugged right in, met a bunch of friends, had tons of events to go to. The kids got to meet all their school friends and Deerwood friends, and it's just been such a quick integration that I really can't imagine living anywhere
Just
else.
since this last summer, you said, is that right?
Yeah, totally.
That's great. That speaks to, says good things about the community in Deerwood and in Jacksonville larger. So let me swing back to maybe the local economic footprint that you're trying to create here, and even just as entrepreneurs. You'd been working for somebody else for a long time, Uncle Sam, as we say.
Yes.
What were the first 2 or 3, I guess, business realities you had to learn over these last 6 or 7 months?
I think the first one is Kyle constantly reminding us that, you know, we're not making a steady paycheck, right? Uncle Sam isn't paying me anymore twice a month. And so financially, I have to kind of adjust how I want to invest and spend our money to fit with the tempo of business.
Yep, yeah, because we saved our money, you know, while we were in the military before that to be able to do this. And so, yeah, that, just learning all this stuff that we didn't have to learn in the military. Like in the military, your patients, they have to come to you.
Yeah.
Like they don't have a choice. And so, you know, trying to, you know, figure out how do you find patients that want to come see you and really enjoy that experience.
So what are some of the answers there? Yeah, how are you doing that? How are you marketing? How are you finding patients who say, yes, Dr. Mikals and Dr. Mikals, I want to see you?
Yes.
So a lot of networking events. I think, you know, over time, you know, people used to go on LinkedIn and try and find people, but really people want that human connection. And so going and meeting people face to face and getting to know them over time really makes you stand out, as opposed to necessarily ads, things like that. Because I tried Google ads and they were not that great for us.
Yeah.
And then Facebook, but then, you know, putting videos on Facebook, just showing who we are, allows people to see what we do.
What kind of response or feedback are you getting?
I've had really great feedback. I go to a lot of events, especially social events, both because I enjoy going, and
It's a good start, right?
I keep telling Kyle, like, you never know who you're gonna meet, right? And even though sometimes I have to drag him out there, afterwards he's like, yeah, you're right, I met someone cool and we really connected over whatever, cooking or something. And then I think for me, because everyone knows what I do, well, as I'm establishing myself in the community, people are finding out and hearing about it. I also just like to give advice, you know, especially skincare. I meet a lot of women, and a lot of people don't know what the basics are to have nice, healthy skin, which is the cheapest step one before you do any of the other treatments. And so I've basically been kind of spreading that knowledge left and right, just giving free advice because why not? I mean,
So how does free advice turn into, hey, you should be a client/patient, right?
yeah. For my aesthetic side, I think that it just helps build that relationship. And people, if they see transformation of their skin with just using products that they bought from Amazon that I told them about, then I think that builds trust in terms of my judgment and the things that I curate, that I use on myself. And so even though they may not end up as a client or patient, maybe they will in the future.
Is it the same for what you do?
That's
Dr.
a little
Kyle?
bit different. I think when I was in Japan, when we were in Japan, I think it really changed how I practice medicine. And before, you know, in the typical way we practice medicine and learn in residency, you know, you just treat the problems after they've happened. And then in Japan, it's just as a society, it's different. You eat differently, smaller portions, you exercise more. I mean, I walk 20,000 steps a day on the weekends. I mean, that's just what you do. And that's the life you live there. And so it really changed I got into lifestyle medicine, where I focused on nutrition and exercise and looking what people eat to help them eat better. And I think people resonate with that.
Certainly trending here in the States, right? In these last several years especially, there's been more attention to, hey, I got to do better on terms of what the fuel I'm putting in the engine over here is.
Yes, absolutely.
So I'm curious about some of this. When you're talking about starting a business, and right now, you've been in leadership positions in the Navy. Now, not many people to lead, right? Is there a plan for Harry? It's going to be more than just the two of us doing this business?
Yes. Yeah, it would be nice to get a pediatrician at some point. Since I'm internal medicine, I only can see those that are 18 and older. And so it'd be great to have a pediatrician, because I've heard from certain businesses, that are interested. And so to be able to provide that.
Full family care.
Yeah, for a full family would be great. And then to get a nurse would be great as well, to be able to just help.
Are there certain markers you have to hit as a business before you can do that?
Yes. So I'm looking at, as we reach a certain number of patients that are enrolled, that we'll be able to get a nurse, and then I'm going to eventually get a physical space. Since right now, she has a physical space, but I just do all home visits. And so we'll eventually, or office visits, and then we'll eventually get a bigger space that we can go into.
Yeah, is this the same for what you're doing?
Yeah, so
you go to people, or are you having them
mostly
into your...
I have people come to me now. So after I got the density radiofrequency collagen machine, which was early October, as part of that process, I needed a home for it. So I got an aesthetic studio in the Parlor Suites right above 14 Prime, the restaurant on Gate Parkway. And it's just a one-room thing, and there's a bunch of other beauty biz people, a lot of hairdressers, permanent makeup, facials, that kind of thing. And so it kind of fit in with that community. So I mostly have people come to me. And it's nice to have a space because I can actually do other ENT stuff, whether it's a consultation, like I mentioned, suturing on the weekends for kind of urgent, emergent little cuts that don't really need the ER. As well as just ENT procedures, like the Tula ear tube procedure. And so I look forward to having more space when we have a big clinic, because there are lots of other ENT toys that I want to buy so that I can provide more services with my skills. But we'll have to work towards that.
Yeah. So as you're working toward this, and again, I pointed out that part of the thing I think is cool is that you're both veterans, and so many people in our area truly appreciate that or have lived that out as well. What would you say if a business leader here in Northeast Florida asked how to support veteran families and retain veteran talent in Jacksonville? What would you tell them to do specifically?
I would tell them, I know a lot of people in the reserve community, and so reserves is huge here, especially for medical reserves. NES Jacksonville has one of the largest medical reserve community, and it's really the employers being supportive and understanding when they're getting called to go do training for 2 weeks, or they need to go to ODS, which is like the not indoctrination, but like the orientation to the military. That's 5 weeks now. Which is, that's really hard for employers to deal with. And so just really being understanding when stuff pops up like that is huge. It really means a lot when they can just be supportive in that way.
Yeah. Dr. Samuel, what would you say about that?
I think that increasing the educational opportunities for active duty or veterans. When we were on our way out of the military, we took the TAPS class, and I made Kyle take the entrepreneurship class there, and I took it a second time with him because they
You made him take it. You made him take it.
I mean, it was so
We're doing this.
good.
You're taking that class.
Yeah, it was the best class I had ever taken in the military, that I had to take it twice. And because it was like a year apart, I learned different things because I was in a different point in my journey. And I'm sure that the course at NAS JAX is good too. That course pointed us towards the Small Business Administration. So kind of integrating all of those things to provide resources, education, just access, especially for military members who are thinking of starting their own small business. I think that's invaluable.
So maybe we wrap up here. Give me the 5-year outlook. What does success look like for you, your practice, and for Jacksonville 5 years from now?
So I think we would have a clinic space, hopefully that we own, and definitely at least a pediatrician, if not several other doctors joining our team who want to have a balanced life with fulfilling relationships with their patients, who aren't overburdened and being told to see more patients in less time and write better notes, right? And so I want to scale so that more doctors could enjoy this kind of career, as well as more patients can enjoy this kind of care.
Yeah, I like it. Dr. Kyle?
It's the same, yeah, being able to expand, allowing, because I have other doctor friends that want to be able to do this and to be able to, be free from the system and those requirements of, being told to do more, see more patients, and, be able to practice medicine the way they want to practice medicine and be able to take care of their patients.
Is it a boon or a hindrance that Jacksonville in this area has so many good, well thought of medical institutions? So we've got hospitals and other care here that people are drawn to.
I think it's a boon. These health systems are world renowned for a reason, and they provide that quaternary, tertiary care that we're lucky is just down the street, right? Or down the freeway or something like that.
Yeah.
And of course, there are a lot of specialists, subspecialists, and of course, primary care who have to be a part of that for the machine to keep running and for patients to be taken care of. But not everyone can work for the system. And so I think that it's nice to have a balance of independent physicians as well, so that we can sit down and take an hour with somebody and go through everything they want to talk about, visit a little bit.
It sounds like you're trying to address some of the things that so many of us as patients see as obstacles or barriers, or just, if I have to get care, I'm going to have to endure long waits, all of those sorts of things that can be troublesome when, man, I just want a doctor to help me feel better, or those sorts of things, right?
Exactly.
Yes. Yeah, it's just helping people get through the system. I mean, the system is just so complicated. And so we're really just trying to help people navigate the complexities just to get the health care that they need.
Yeah. Well, let me wrap up here. Thank you so much, both of you, for your service to the country and what you did in our armed forces, and for what you're building here in Jacksonville. Really appreciate getting to talk through that. Dr. Samantha Mikals, Dr. Kyle Mikals, our guests today. Thank you very, very much. And thank you so much for listening or watching This Week in Jacksonville Business Edition. New episodes come out every Thursday at 9 a.m.